Let me share screen. Okay. Whenever you're ready, Maggie.
Okay, I'm stuck.
Yes.
Okay. Well, group two, and our topic is delayed wound healing. Next. Okay. So there's normal wound healing process in four phases. The first one is homeostasis, and the second one is inflammation. Third one is proliferation, and the end of is tissue remodeling. Next one, and uh, the risk factors of wound healing delayed. Uh, there's a local factor is about low oxygen in the tissues, and also local infection or foreign body, or there's poor venous function will impact the wound healing. Next one. And also there's a symptom factors depends on age or gender. Usually in old people, there's more higher risk for the delayed the wound healing. And also there's depends on the hormones or stresses, or patient have some disease just like diabetes, or other uh, like kidney or liver function is really poor. Also, patient have overweight, and some medication can impact the wound healing. Also, if patient has alcohol abuse or smoking, or there's some special conditions like cancer or HIV or poor nutrition, also is high risk for the wound healing. Next one. And there's one to 2% population will experience chronic wound healing in developed countries, and in US is 2015. There's a chronic wound report. There's a factor 6.5 million people with more than 25 billion each year to treat this kind of the problem. And in UK, there's also patient have the chronic wound will spend maybe 3.4 to 4.6 billion per year for the treatment. Next one. And differential diagnosis with vascular problem like arterial or mixed venous, and arterial maybe make patients skin ulcer, or there's a pressure or neutral or trauma, um, or patient like some special disease to make the patient's skin have some ulcer is different with the wound healing. That's it. Okay, I'm good.
So going over the pathophysiology of delayed wound healing, we got to understand how the normal pathophysiology of normal wound healing occurs. So as Maggie stated before, we have four phases. Phase 1 is a hemostasis or coagulation. So we have immediate tissue injury, which causes bleeding due to damaged capillaries and blood vessels, which immediately is followed by vasoconstriction and vasodilation, which in turn activates the coagulation cascade, and platelets eventually come by to form clots and thrombuses. Phase 2, again, begins immediately within minutes at the site of injury. We have a cellular inflammation response. Macrophages and mast cells release vasoactive cytokines, increase blood flow to the wound, which then increases cellular response and necessary proteins to the area of injury. It brings the necessary nutrients and cells to help fight off any foreign invaders or pathogens. Neutrophils clear the wound of debris site and bacteria, and lymphocytes again initiate the immune response, again fighting off any foreign pathogens or bacteria. Phase 3, we have proliferation and new tissue formation, begins 3 to 14 days after injury. The body again has the invasion of macrophage cells, which are responsible again for clearing debris, which release again, they also release growth factors, recruit fibroblasts, which are important cells used during the healing process as they secrete collagen, and collagen is the main factor for wound healing. Collagen is the most abundant protein. It's highly concentrated in amino acids and used very frequently during the healing process. And when it comes to delayed wound healing, this is what's going to be it's going to be disrupted. In angiogenesis. Angiogenesis is the formation of new vessels. So again, we have nutrition, supplements that are important: iron, vitamin C, and oxygen. Phase 4, we have remolding and maturation, which begins several weeks after the injury. We have scar tissue that reaches 2/3 of its full strength in 2-3 weeks. The collagen synthesis takes place, and tissue regeneration and formation eventually occurs during this phase. And again, healing the wound. If we look at the next slide, we see the a visual component of the 4 phases. We have hemostasis here, inflammation, proliferation, and maturation. The next slide, we have the causes, as Maggie mentioned before, of delayed wound healing. Signs and symptoms: we have ischemic tissue, excessive bleeding, excessive fibrin, obesity, diabetes, wound maturation, malnutrition, medications, tobacco smoke, and dysfunctional collagen synthesis. And if we go to the next slide, we're going to go over them. Ischemic tissue very much is this oxygen-deprived tissue, and is susceptible to cellular death and infection, which causes a prolonged inflammatory response and impaired collagen synthesis, eventually delaying wound healing. Next, we have excessive bleeding, which is caused by large clots increasing the amount of spacing that granulation must fill. Clots then serve as a mechanical barrier to oxygen diffusion, and then we have a decreased volume associated with bleeding that inhibits inflammation. Next, we have excessive fibrin. Fibrous adhesions form, causing fibrous bands to form that can distort, impinge on, or strangulate organs, causing impaired healing. Next, we have obesity, another risk factor which causes impaired leukocytes function, which predisposes the wound to infection, decreased growth factor production, increased pro-inflammatory cytokines, dysregulation of collagen synthesis, and decreases in angiogenesis. And we have diabetes, which hyperglycemia causes prolonged wound healing and infection, and the wound tends to become more ischemic because of the prevalence of small vessel disease and impaired blood flow. And if we go to the next slide, we'll finish off here with wound infection of infiltration of pathogens, which cause damage to the cells, stimulating the continued release of inflammatory mediators, which consume nutrients and delay healing. We have malnutrition, which is pretty much just poor nutritional status, prolonged lack of vitamins, iron, zinc, magnesium, copper, all required for collagen synthesis, and poor collagen synthesis, again, delays wound healing. Medications such as NSAIDs, steroids, and antineoplastics all delay wound healing. NSAIDs are associated with excessive scarring. Steroids inhibit fibroblast migration, which is important for collagen release. And antineoplastics slow cell division and inhibit angiogenesis. Tobacco smoke, which is a potent vasoconstrictor, compromises wound healing by predisposing tissue and ischemia and infection. And lastly, we have dysfunctional collagen synthesis, which is just an excessive production of collagen, which can result in hypertrophic scar or keloid, pretty much extending collagen growth. And then finish it off, pass it on to Victor.
Okay, hi everyone, I'm Victor. I'm just going to talk to you guys about the diagnostics and labs. So we have albumin and prealbumin. So albumin is sensitive to long-term protein deficiencies, whereas prealbumin focuses on the shorter term, so like the past 2 to 3 days. So it's a better indicator of acute nutritional changes, and the extent of albumin's decrease helps predict the risk of pressure ulcer formation. So then we have hemoglobin A1C. This diagnostic test helps determine patient's blood glucose over a period of 3 months. So we can tell if the patient has been having excessive blood glucose for a longer period of time. So it's crucial for wound healing because elevated glucose impairs wound healing and the ability to fight infection. Uncontrolled glucose for 3 months can lead to serious delays in wound healing. Then we have the CBC, so complete blood count. So blood components are important to review because they directly correlate to wound healing process. So specifically, we're going to look at platelets because platelets rush to form the clot and prevent further bleeding, and they also release cytokines, which call upon other cells to help in the later stages of wound healing. Without proper platelet count, wound healing will be delayed. So there's also the corpuscular hemoglobin concentration. So this tells us how much hemoglobin is given in a volume of red blood cells. So less hemoglobin equals less oxygen carrying capacity, and oxygen is needed for tissue perfusion and wound healing. Then we're going to go ahead and talk about the treatments. So immediate intervention and frequent assessment is crucial for the treatment of wounds and delayed healing. So in these patients, immobility is a huge risk factor for pressure ulcer development among adult hospitalized clients. So with intervention, so infected wounds need surgical debridement with systemic antibiotics. If possible, patients should undergo non-invasive vascular evaluation and angiography, and if indicated, revascularization procedures. Main goal is enhancing blood flow to the wound to promote perfusion and increase the speed at which the wound will heal. Also, patients should undergo intense physical therapy to help alleviate immobility status, which is further contributing to their delayed healing. So we're also going to need to do a lot of frequent assessments. So assess nutritional status, assess the wound site frequently, and also assess for fecal or urinary incontinence. So urea in urine, it turns to ammonia, and it could just further erode the skin and just make the wound worse, as well as stool. We also are going to want to assess for bony prominences, so like heels and elbows. These are high risk areas for breakdown resulting from tissue ischemia from compression against a hard surface. So it's also important to use tools like the Braden scale to know the patients are at risk of developing complications. So we're going to go into some evidence-based practice on delayed wound healing. So from the research, we found that it focuses on ischemic conditions. So ischemia is a condition that results in chronic non-healing wounds and can be seen in arterial insufficiency, venous hypertension, and pressure injuries. So ischemia due to arterial insufficiency. So according to the American College of Surgeons, in patients with arterial insufficiency, arterial blood flow on the tissue is diminished, leading to a decrease in the delivery of oxygen and nutrients to the wound. And so we know about oxygen and nutrients to wounds, it's very important for healing. So impairment in the removal of metabolic waste products from the wound as well. So due to chronic deficiency of oxygen, a simple cut or abrasion on the skin may be caused by a fall or poor fitting shoes can lead to a chronic wound. Most common cause of arterial insufficiency is obstruction from atherosclerosis. Next, we have ischemic conditions from venous hypertension. So patients with chronic DVTs or AV fistulas increase hydrostatic pressure leading to venous hypertension. So the sluggish movement of blood leads to fibrinogen leaking from the capillaries, resulting in a fibrin cutoff formation, which decreases oxygen permeability. This decrease in oxygen permeability causes tissue hypoxia, which impairs wound healing. So then lastly, we have ischemia due to pressure injuries. So bony prominences and immobile patients or patients who aren't turned as often as they should be. This cuts off oxygen and nutrient delivery to the tissue, resulting in hypoxia and accumulation of waste products again. So although ischemia can vary among individuals, pressure injuries can develop within 1 to 4 hours of sustained pressure load. And so we're going to talk about some pharmacogenetics here. So wound physiology, there's acute versus chronic. In acute wound healing, it's an intricate process, as stated previously by Maggie and Francis. There's the 4 stages. And then so these different cell types and growth factors, along with patient history, congregate for each individual's unique response to wound healing. And then in chronic, certain conditions cause wound healing to be impaired. So in chronic wounds, instead of moving forward to the next healing phase, kind of gets stuck in the inflammation phase. So the impaired vascularization, as previously stated, it'll lead to hypoxia. So the wound isn't getting oxygen and nutrients it needs. And so different things like diabetes from poor glucose control or bony prominences and many other factors play a role in each individual's wound healing. So I'm going to go ahead and pass it off to Nadezhda, and she's going to talk to you about prognosis.
So next, we're going to be talking about the wound healing prognosis. Pretty much the delay wound healing prognosis is dependent on some factors, which will be whether or not the wound is infected, the type of the wound, and the patient's underlying diseases, the underlying conditions that the patient may have. Next slide, please. For example, an infected wound can have a poor prognosis because of all the inflammatory cascade that takes place. Also, like we mentioned before, patients who have comorbidities like diabetes, obesity, or patients who are taking immunosuppressant drugs also may have a poor, the wound healing, the delay wound healing may have a poor prognosis. But a patient who have less comorbidities, who have adequate nutrition, can have a better prognosis. Next, we're going to be talking about nursing care plan for delayed wound healing. So when we talk about wound, the first thing that comes in mind is impaired tissue integrity. So our nursing diagnosis is impaired tissue integrity related to mechanical factors, infection, immobility, or altered circulation, which are some of the factors that could cause impaired tissue integrity. So the goal, our first goal is the patient's wound will decrease in size and have increased granulation tissue in 7 days. Our first nursing intervention is to assess the wound characteristics, such as the color, the size of the wound, check for length, width, and depth if the wound is tunneling, check for drainage, odor, and all of those will indicate whether the patient has the wound is infected or not. And our next nursing intervention will be to perform wound care. We need to perform adequate wound care with wound cleansing and apply adequate treatment as ordered by the doctor or the wound care nurse, because by doing the wound care adequately as it is, it will promote the tissue granulation and healing faster. The next nursing intervention that we have is administer a medication, whether it is antibiotics for infected wound, and also medications such as supplements that will promote wound healing, vitamin A, C, and Z, and also the next intervention will be to provide a well-balanced diet to a patient that is rich in proteins, and we'll have to coordinate that with other nutritional services. Our nursing goal is patient will be able to report any altered sensation of pain outside of the tissue impairment during a 12-hour shift. So our nursing intervention for this goal will be to assess the pain level, the discomfort, and duration of warmth of the wound every shift. And our next nursing intervention will be to educate the patient to avoid practices such as massage, friction, or long or prolonged pressure that may cause pain or alter sensation at the impairment site. Meaning for our patients that are immobilized, or like our older patient, we need to make sure that we turn them frequently and then also avoid friction as much as possible. So this conclude our nursing care plan and diagnosis, and as well as our presentation on a delayed wound healing. Thank you for listening.
Awesome. You guys are amazing.